Hi, it's Misty Dominguez recording a patient-centered care oral presentation for Nursing 520, assignment 3.1. We ask ourselves, what is patient-centered care? I believe patient-centered care is a multidisciplinary approach to healthcare that focuses on customizing a plan of care to an individual based on their expressed desires and their goal of care. Ultimately, the patient needs to control their own experience throughout the shared decision-making process in order to achieve the goals of care that matter most to them. Today, we're going to be discussing a case that I think exemplifies what patient-centered care is all about. In my practice about 2 years ago, I was working as a case manager, and it came across a situation where we had a 52-year-old male, otherwise relatively healthy, presented to the ED with severe abdominal pain for the last 12 hours or so, and he had new onset vomiting. Through his interview process, he revealed that he really had no other medical problems, but did share that after he started thinking about things, he had lost about 20 pounds over the last 3 months, which he associated with his new exercise regime, and had complained of some intermittent pain of the abdomen and nausea. He was on no medications. His social assessment revealed he was married. He had 2 grown children. His daughter was pregnant with his first grandchild, and he's very excited to meet the granddaughter soon. Unfortunately, this gentleman was ultimately diagnosed with new onset metastatic pancreatic cancer and had a tumor that was partially obstructing the common bile duct. For this particular example, care took place across the continuum. The care initiated in the acute care hospital. Our team followed after discharge and continued following through his transition from his primary care office into a patient-centered medical home environment, and also the care crossed into the patient's home at times. We asked who was participating, who was on the team. First, in the acute care environment was the hospitalist. The hospitalist, unfortunately, was the person who had to share the new diagnosis with the patient and also disclose the prognosis related to the disease process to the patient and the family. Part of the treatment plan was to involve a gastroenterologist. He came in and provided recommendations to manage the common bile duct obstruction, relieve the jaundice, and also adjusted medications to relieve the nausea that was causing the patient so much discomfort. In addition, the multifaceted team was composed of an RN case manager. Her role was to assess the social situation of the patient, determine what their desires were, talk with the patient and find out what his goals of care were, and coordinate care from the hospital acute environment through the outpatient setting and link the patient with the support needed to have a successful transition. Additionally, there was a medical social worker that was consulted. In this particular environment, the medical social worker carries the responsibility of managing the patient situation from initial contact through disposition. The medical social worker was excellent in managing the dynamics associated with a new diagnosis. She remained a strong advocate for the patient based on their wishes and offered support through the grieving process to both the patient and the family as they processed the new information. As the diagnosis progressed, a palliative care nurse was also involved. Originally, the palliative care nurse came in as an introduction, and her role grew as the patient's goals changed. She educated the patient, the family, much of the time just listened and provided support, and ultimately was the key component in transitioning this patient's care to an end-of-life goal. I think this particular graphic demonstrates how patient care is supposed to be comprised. We have the patient at the center of the continuum. You have maybe a hospitalist, a specialist, case management, a medical social worker, the palliative care nurse, and the family that are surrounding this patient, listening to them, dialoguing, and determining what their goals of care are. It's just kind of like a big hug around the patient and working out the best plan of care. So we ask ourselves, what are the patient care outcomes? What happened in this case? The medical team, their goal was to provide a clear understanding to the patient and his family of what his diagnosis and prognosis was. In this particular case, that goal was met. The patient and family were able to articulate the diagnosis and the treatment plan and options, and also were understanding the prognosis of a stage 4 metastatic pancreatic disease. The GI specialist came in, provided recommendations for treatment to relieve the common bile duct obstruction, and also optimized some medications to help relieve some of the nausea, and ultimately decided this patient was to be best suited on long-term TPN therapy because he was not tolerating oral intake. So in this case, again, the goal was met. A stent was placed, patient started on Zofran IV, eventually did transition to oral for a short period of time before reverting back to IV medications. The RN case manager, her role was clear discharge planning, really taking in mind what the patient and the family really wanted, and had to be creative and link the patient appropriately to needed support specialties after the acute episode had occurred. All equipment was delivered to the home. Home health was arranged. TPN was initiated. PICC line management initiated. Social services referral took place. The palliative care nurse team and the outpatient case management team handoff took place. So that was a successful goal as well. Social services played an integral part in this patient and family's well-being. They advocated on behalf of the patient, provided the support they needed when they were making difficult decisions without an agenda. So this goal again was met. This team formed a bond with the family and a relationship that allowed the family a level of comfort that followed them not only from the acute setting all the way through until the patient's ultimate demise. The palliative care nurse was also important in this process. The goals of care from the palliative perspective were to educate the family and link them to any options they chose as the disease progressed. Her role in the acute setting was informational, but as the care continued, ultimately this patient and family reached out to the palliative care nurse to arrange hospice once he was emotionally ready to do so. What lessons did we learn? I think what's most important is that we remain individual patient care centric, and the patient has to remain the focus of care. If we do so, we can achieve excellent management. It is integral to make sure that the involvement of the patient and family are dictating our successes, and we're not focusing with another agenda. I think systems of care is crucial as well. The system of care for this particular patient included making sure all participants maintain the goal of the patient in mind as their center focus. Communication had to remain impeccable. All parties needed to remain focused, patient-centric, and driven to achieve the goals desired. The interprofessional team, I think what we can all do to remember how to best serve a patient is that it does take a village. It's not one discipline, one specialist. It is a group of individuals all functioning to the top of their ability in cohesion, and remembering that we all have something valuable to offer and we all can help the patient in our own way. And I think we all have to be prepared as providers to understand that the team is going to have to continue through the continuum, and not just in the acute episode of care, but throughout the continuum of the disease process, and be prepared to support the family in the acute phase, the subacute phase, and even at end of life if need be. Optimal patient outcomes can be achieved when the patient's goal of care is met. I think we all achieve success. Success is dependent on remembering who we're working for and who we're working to help. And if we remember that the patient is the driver, then I think we retain our focus, and we all are working for a common goal. How could we have improved in this particular situation? I think retrospectively, we look back and possible suggestion for improvement could be in order to meet this patient's goals, maybe we could have reached out proactively as to the member as a member of a healthcare plan and had the discussion regarding advanced directives prior to an acute event such as this member's diagnosis. The reason being, I think if we reach out proactively, we connect with people when they're not in a crisis situation, and the individuals then have the luxury to go about thinking about what they really want and really having those tough conversations with family before an urgent decision is needed. Another suggestion for improvement would be to empower members to know their resources. I think if we can encourage patients to utilize their outside resources like their primary care team, estate planning, getting advanced directives in writing, DPOAs for healthcare and finance, I think we do see patients becoming more compliant. They take ownership of their care. And I think we also see increased wellness in general when patients are linked to their providers, feel connected to them, and are following up routinely. In this particular case, I'm not necessarily certain that PCP involvement would have made a difference in the ultimate outcome, but for some patients, that is the case. Additionally, I think another suggestion for improvement is to make sure we embrace the patient and family unit as in a whole and really listen to their goals and customize our approach to meet those goals. In order to do that, I think we have to actively listen, which can be a very difficult task in healthcare. We're used to dictating and teaching and talking, but listening sometimes is the most important and effective means of communication. When you hear people, you can really connect. And I think lastly, in this particular situation, being that it was a healthcare organization team, I think we have to be diligent and remember that we cannot bring our personal or organizational agendas into communications with patient. It is really a fine line. I mean, you may have representation for a healthcare plan, but to have true patient-centered care, we have to know that all care is about the patient and their desired outcomes and their goals, and we all have to work in conjunction to meet those goals. Lastly, in summary, just to give you a follow-up, this gentleman did meet his goal. Although he had a tragic diagnosis, he was able to see his granddaughter come into the world. As he wished, he was able to spend one final Christmas with his family, and he did finally expire under the care of hospice services on January 21st. He was surrounded by his family. He was pain-free. And ultimately, if we look back to his original goal, that was what it was. He knew, he was an educated man, and he knew his diagnosis was terminal. But he also knew he needed to achieve a few final milestones for his family's sake and for his own prior to accepting his untimely death. And so I think this is an example of how a system can really truly provide patient-centered care. All parts of this team, all disciplines worked collaboratively and all within a singular focus. We were truly patient-centered, and I think that is possible so long as we maintain open dialogue, truly hear what our patients are telling us, we practice creatively, and remain diligent in our advocacy. We can be successful. And I think patient-centered care is the future. And if we embrace it now, we will have much better outcomes for us and our families. Thank you for your time. I've really enjoyed presenting the situation to you, and I welcome all feedback. Thank you very much.